So in terms of how can mHealth improve pharmacy practice, I think coming back to how I was saying about with engagement, let's give a certain scenario. I work in transitions of care and I'm actually cardiology, despite all my interest in technology and what I'm probably most well known for. How I look at this is that I could use technology to be a better pharmacist to engage with our patients on the level of their care, especially with post-discharge. So let's imagine a person comes in that has decompensated heart failure. They just got admitted and now they're being discharged. You know, they're going to go home and we're going to give them the normal routine education about watching their weight, about taking their diuretics, about being adherent to their medications to follow up with us in several weeks. And what if we could have data that we could collect on them on the outside and not wait for them to call us when something may go wrong? What if instead they had a Bluetooth monitor weight scale at home that they would step on and I would get in the EHR whether or not they did gain those 2 pounds or 3 pounds overnight? What if I had a Bluetooth bottle that would tell me whether or not they're actually being adherent with their diuretics and taking them on a regular basis and not skipping doses? What if there was a blood pressure monitor? So, you know, I may have added an ACE inhibitor, beta blocker while recently, and I'm trying to make sure that their blood pressure isn't going too low and that they're actually being at risk for an adverse event from their medication. We can collect all this data, and not to imply data overload, which no one wants. We don't want alert fatigue. You could then have the correct analytics in place that you could then say, if these variables happen, this is a patient I want to follow up with. Saying that, I'm not the only one thinking this. There are many health systems out there and many trials going on to try to determine in high-risk patients whether mHealth may be a way for us to reduce readmissions and help actually these patients stay at home where they want to be.